Well, thank you. Good. Well, let's see. Can you hear me all right?
Yeah, we hear you loud and clear.
So I've got, okay, good. Well, it's nice to be back with you. I had a chance to talk to you about the environment last time. I had a chance to share with you my strong feelings about destroying the planet and killing animals and killing salmon in particular on my last encounter with you. And what I want to talk to you about this time is I want to talk to you about the way I take care of patients. I've made a series of lectures, and they can be found on our channel, which is the McDougall channel. A series of lectures on how I would like to care for you if I was your doctor. You know, if we had a chance to sit down together, these are the things that I want you to know. And since we won't have that chance, you know, I provide these videos for your own physician to listen to, or for you to take this challenging information to your physicians and say, look, why can't you treat me this way? You know, this is the way Dr. McDougall treats his patients. And here's all the science. And I want to be cared for this way because it makes a lot of sense to me. So I've done a series on heart disease, one on autoimmune diseases. I've done diabetes, breast cancer, and obesity, probably a few others too. So the one I'd like to present for you today is diabetes because it's so common. You know, half of the people in the United States are pre-diabetic and somewhere around 14% are frankly diabetic. So this is something that applies either to you or a family member or an associate, a friend. So I hope I have your attention. Some of this gets a little bit complex, but I'll identify when you can either turn me off or you can pay a little closer attention to understand what's going on when we talk about diabetes. Okay. All looks clear for you folks? So again, this is the discussion that I think you should have with your private medical doctor. And I would certainly love to have this discussion with you if you had type 2 diabetes. And I want to mention one other thing as I get started is because of COVID-19, I mean, a lot of terrible things happen to people because of this virus. But some really positive things happened to us is we had to close our resort program in Santa Rosa, California. But, you know, as one door closes, another one opens, and we started a telemedicine program, a telehealth program about almost 2 years ago. The results have been far, far better than we not only expected, but far better than the program I used to run at St. Helena Hospital for 16 years, and the program that I ran at the resort for 18 years. We're getting better results. People are happier. The staff is happier. The cost has been reduced by about 2/3. Yeah, instead of costing you as much as $10,000 to come out to the resort, which includes your travel, it's down to around $3,000 to spend 12 days with us in a very personal interaction. You get medical care, you get help getting off your medications when appropriate, which it almost always is. In fact, our results published show that we are able to reduce or stop nearly 90% of the medications that people are taking, particularly diabetic and blood pressure medications. You need physician's supervision, or at least a healthcare provider who really knows what's going on. That doesn't necessarily apply to physicians as far as knowing what's going on. But you need to have somebody who is aware of what happens to you when you change your diet and how you need to timely change your medications. Now, I'm going to talk to you about the way I treat it, type 1 and type 2 diabetes, and you'll see what I do. And again, you can share this with your personal physician. The way that we diagnose diabetes is with a fasting blood sugar. This is an immediate sign of whether you have diabetes or not. What you do is you take by a testing meter or at a laboratory, you take a blood sugar at that particular moment. If the blood sugar happens to be above 126 milligrams per deciliter, then you're declared as being diabetic. The other way we check for diabetes is with a hemoglobin A1C, which is a measurement of your diabetes control over several weeks to months. And a normal hemoglobin A1C is maybe 6%, maybe 6.5%, maybe 5.8%, depends upon who you're listening to. Both types of diabetes, type 1 and type 2, have in common the fact that they have a blood sugar that's elevated. And the symptoms for both types of diabetes are increased urination, increased thirst, and excessive weight loss. With type 1 diabetes, you could get very sick and end up in the hospital if you were to stop your insulin. You never stop your insulin with type 1 diabetes. Long term, what happens is people have damage to all of their tissues. The whole body falls apart when you have diabetes because you've developed a metabolic handicap, which is the diabetes condition. And you can't defend yourself from the rich American diet. And as a result, diabetics fall apart at a rampant rate. They lose their legs, they have heart attacks, they go blind, they have kidney failure. And that's because of this handicap of diabetes. And you can correct this completely when it comes to type 2 diabetes. You can make a whole big lot of difference when it comes to type 1 diabetes. In other words, type 1 diabetics, they don't have to suffer premature death and a lifetime of sickness if they change their diet. This is the difficult part, but I'd like to try and explain it to you what is going on. We have to talk about three different factors here. One is the transport mechanism that occurs at the cellular level, and that's represented by the Y-type figure that you see there in red. What happens is you have a transporting system present in the cell membrane that transports the glucose, the blood sugar, which is represented by the orange triangles. But to get this transport system to work, you have to open it up with a key, and that key is insulin. So we're going to talk about different types of diabetes in terms of whether or not you have adequate blood sugar, whether or not you have adequate transport, or whether or not you have adequate insulin. When it comes to normal, everything works. Your transport system works just fine. The sugar is able to get inside your cells out of the bloodstream, and you have plenty of insulin around to allow this to happen. We're going to be talking about type 1 and type 2 diabetes and something called type 1.5 diabetes, which has a different type of alignment when it comes to these three factors. But just start with now understanding that you have this active transport, which is only allowed to be active if you have insulin. And then what happens is the sugar goes from the bloodstream into the cells where it performs its activity, gives you energy, which it's supposed to do. Let's talk about type 1 diabetes to begin. In type 1 diabetics, what you have is you have an active transport system. You've got plenty of sugar in your bloodstream. You just don't have the keys to open up the transport system. In other words, you're insulin deficient when it comes to type 1 diabetes. So the sugar does not get into the cells. Essentially what happens is you starve at a cellular level. And you notice a really high blood sugar in your bloodstream and throughout your whole body. And that's type 1 diabetes. Type 1 diabetes is due to an autoimmune condition. It's where the body attacks the pancreas. The pancreas is an important organ, and it has cells in it that produce insulin. They're called beta cells. And the normal pancreas has lots and lots of beta cells. In the abnormal pancreas, like with type 1 diabetes, the beta cells have been destroyed. What destroys the beta cells is something called molecular mimicry. It's where the body, through an autoimmune condition, has a reaction, as it should, to a foreign protein. And we're going to talk about that foreign protein being animal foods, particularly cow's milk. The body makes antibodies to cow's milk, but these antibodies aren't just specific to the cow's milk. They also find similar structures on your beta cells of your pancreas. And this was determined back in 1992. In fact, since then, there should be no argument about what causes type 1 diabetes. Investigators, they found 17 amino acids present in the beta casein portion of the milk. 17 amino acids, which were represented on the surface of the beta cells of the pancreas. Same structure, same identical. And what happens is the body's antibodies, which are out looking for the cow protein, the milk protein, end up finding the same structure of amino acids on the surface cell of the pancreas, and they attach and they destroy these beta cells. It takes about 3 to 7 years on average to destroy all the beta cells of the pancreas to create a condition called type 1 diabetes. So how do you treat type 1 diabetes? Well, you have to take insulin. And when I take care of somebody who has type 1 diabetes, what I do routinely is I reduce the dose of their insulin by about 1/3 to 1/2. Because what happens when you change your diet to a high carbohydrate diet is the insulin becomes more effective, it becomes more powerful. And if you don't reduce it, what happens is people develop hypoglycemia, which can be a very dangerous situation. With hypoglycemia, you can get in an auto accident, you could fall down, you could be picked up by a police officer suspected of having a DUI. It's a serious problem. You want to avoid hypoglycemia at all costs, including the costs of giving too little as opposed to too much insulin. It's always safer to give too little when you're making the adjustment as opposed to too much. Now, I take care of my type 1 diabetics by giving them insulin shots. My goal is to try and give them 1 shot a day by using a long-acting insulin called Lantus or Levemir. And many of the type 1 diabetics could get away with just having 1 shot in the evening. At most, they'll have to take some supplemental long or short-acting insulin. But I try and minimize the amount of shots that they have to take every day, because that means they have more time to enjoy other parts of their life. They don't have to be focused on their diabetes all the time. Unfortunately, somebody who is diabetic, they think about their blood sugar. They think about how much insulin they have to draw up and shoot themselves with. And it is exaggerated to an extreme extent if you happen to have a glucose monitor that's attached to you, which checks your sugar every few minutes to every few hours. And worse yet, you have an insulin pump that pumps a certain dose of insulin to you. And so you spend your day, and the people around you spend their day talking about your blood sugar, talking about how much insulin you've taken, instead of enjoying life. So you want to minimize this disease as much as possible in people's lives. Yet, as I mentioned, you always have to give insulin for a type 1 diabetic. Now, type 2 diabetes. I'm going to talk to you about curing this disease, but let's first talk about how you get type 2 diabetes. With type 2 diabetes, you have plenty of insulin. You have plenty of insulin. You have plenty of blood sugar in your system. It's just that your transport mechanism has shut down. You've developed insulin resistance, so that even though the insulin is there to open up the active transports, your transport system has become inactive. It's called insulin resistance. You've heard about that. It's a normal condition. It's not a disease. It's what the body's supposed to do. And I'll explain to you why the body is supposed to do this. So that's type 2 diabetes. Under normal circumstances, the body gains a certain amount of fat, particularly in the fall, the winter, or in the late summer and the fall, getting ready for winter. You could gain maybe 20, 30 pounds, maybe 50 pounds. And that's enough to make you through the winter, but you don't want to gain any more. I mean, that 20, 30, 40, 50 pounds of extra body fat, that's intended for better survival. That's to keep you alive longer and through the winter. But what if you were to gain more weight? What if you were to gain 100 pounds or 300 pounds or 500 pounds? Then you couldn't get away from the saber-toothed tiger. You couldn't get away. You couldn't get into the cave entrance. In other words, it would be a terrible survival disadvantage to gain more than what you need to get through the winter. So what happens is the body shuts down its ability to store fat. Insulin drives fat into fat cells. You develop insulin resistance naturally, normally, and correctly. This is not a disease. It's the body's metabolic adaptation for survival, so that you don't end up to weigh 3, 4, 5, 6, 800 pounds. I have taken care of several patients in my career that did not develop insulin resistance, and they've gained 300, 400, 500 pounds. These are relatively healthy people. Sure, they have damage to their lower extremities, but they don't have heart disease. They don't have high blood pressure. They don't have high cholesterol. They're healthy except for the added weight. What happens in these individuals, unfortunately, there are just a few of them, is they do not develop insulin resistance as a normal, healthy person would. So how do I treat a type 2 diabetic? With a type 2 diabetic, what I do is I stop all their medications. Yes, I do, from day one. I'll find myself in a situation where commonly I'll stop 30, 40 units of insulin a day. But I have been in situations where I've stopped as much as 120 or 140 units of insulin a day on a type 2 diabetic. But, I have a lot of experience doing that. So I can pretty much guess who's going to do well, who is truly a diabetic that does not require insulin. They're non-insulin dependent diabetics or type 2 diabetics. So I stop all their medication day one, and I treat them with food. Now there's an intermediary type of situation. It's called type 1.5 diabetes. With type 1, you have insufficient insulin. With type 2, you have plenty of insulin production. It's just your transport mechanism's been shut down due to insulin resistance. Type 1.5 diabetes is this condition. Plenty of sugar. You have plenty of insulin, but some of your active transport has been shut down. And I see this commonly. Now, this is a situation, type 1.5 diabetes, where you're not so diabetic that you end up in the hospital with ketoacidosis, but you still find yourself having an elevated blood sugar. You may find yourself losing too much weight, suffering from frequent urination and excessive thirst. So how do I treat a type 1.5 diabetic? Well, some of them are going to require medication. What I do is I put them on medication and I use insulin only. I don't use any of the diabetic pills because they're dangerous. They may need insulin. I try and give them a long-acting insulin. I give them just enough to cover up their symptoms, and their symptoms may be too much weight loss. So I stop the weight loss. It may be excessive urination or excessive thirst. And those symptoms are also stopped when you give a little bit of insulin. And you can end up just giving them a small injection once in the evening of a long-acting insulin to cover these particular symptoms. But again, this is a type 1.5 diabetic who has a partial problem. They're not fully type 1 diabetic, and they're not fully type 2 diabetic. They developed some insulin resistance, but not complete insulin resistance. And again, you want to be careful about giving insulin, and even in this condition, because you don't want to develop hypoglycemia for the reasons I told you. It's a dangerous condition. So it's better to err on the side of too little insulin rather than too much. I'll talk to you about why I don't provide the pills in people for type 1 or type 2 diabetes. Let's talk about the medications on how you treat a diabetic. This is type 2 diabetics. The first line therapy, and pretty much all doctors teach this and treat their patients this way, is they start them off on metformin, also known as glucophage. And the sales pitch is it doesn't cause weight gain, and it may benefit the arteries. In other words, it's the medication that does the least amount of harm of all the oral medications, glucophage. 58 million Medicare patients, over half of them were on glucophage as their first-line therapy. The idea that glucophage will decrease your risk of artery disease, heart disease, and blindness, et cetera, is in much contention. A review of the studies showed that 31% show an increased risk of all-cause mortality and 64% increase in cardiovascular mortality when they take metformin or glucophage. In other words, it really hasn't been determined whether or not glucophage really can use the bragging rights of saying that it decreases the risk of vascular disease. And doctors who are doing it based on their best guess or a fairy tale. The second line therapy, and the next medication I find people taking, is sulfonylureas. This is a medication that was developed just about the time I started in medicine, back in the 1950s. I started in medicine in the 1960s. Sulfonylureas were first used as herbicides, but they noticed that they decreased the blood sugar level by increasing the production of insulin by the pancreas. This represents, these kinds of medications, 30% of the sales of diabetic medications. And they go under various names. Back even in the 1970s, when I was a young doctor, the warnings appeared in the physician's desk reference about using these kinds of medications. This is a snapshot out of the physician's desk reference. It's titled Warnings, Special Warning on Increased Risk of Cardiovascular Mortality. And what they say is you increase your risk of dying of heart disease by 2.5 times compared to similar diabetics who don't take any medication at all. 2.5 times the risk of dying of heart disease. Why would you give a pill to a patient that increases the risk of dying of heart disease? Yeah, it lowers their blood sugar, but they end up dead earlier. Now, intensive therapy of diabetics has always been the goal of doctors. And pharmaceutical companies have done the best they can to provide the medications to lower the blood sugar. So there have been 6 major studies comparing aggressive treatment where you make the blood sugar closer to normal, say 100 milligrams per deciliter, and the hemoglobin A1C closer to normal, which is 6%. There have been 6 and only 6 major studies that have looked at this. Now, I'm going to go through these studies quickly with you, and you could stop the slide presentation as you're watching it through your video download. And you can look up the studies and you can see whether or not I'm telling you the truth or I'm exaggerating what's going on. I have no doubt that you're going to read the studies the same way I do. The first study, the Diabetic Control and Complications Study, their conclusion was it may increase your risk of coronary artery disease. The second study done was the Veterans Affairs study. There were 2 veteran studies done. They found a strong tendency toward worsening cardiovascular outcomes in patients with intensive control. The third study done was the TRACE study, which was done in Europe. It's the largest study done on treating aggressively type 2 diabetics. And they showed an increased mortality from heart attacks in patients who were intensively treated. The difference being they compared a group of patients who had regular care, say their hemoglobin A1Cs were in the 7% to 8% range, compared to patients in the intervention group who were given as many as 4 pills a day, checked their blood sugars as much as 4 times a day, gave themselves multiple insulin shots to cause their hemoglobin A1C to reduce down to close to 6%. And they accomplished that. They reduced their hemoglobin A1Cs down to close to 6%. But the outcome that you care about, which is staying alive, didn't turn out. There are the following 3 studies that were published in the New England Journal of Medicine in the year 2008. The first study was the ACCORD study. The Heart, Lung, and Blood Institute stopped the ACCORD study 17 months early because of an increased risk of dying in the treated group. The ADVANCE study, no significant benefits from type 2 diabetes, but they had much more hypoglycemia. And then there was the Veterans study. They showed a weight gain of 18 pounds compared to the control group, which gained 9 pounds. And they showed 3 times the risk of sudden death. There are the 6 studies that show you that aggressive treatment of diabetes kills. Well, it's not surprising because an approval of a diabetic drug depends upon whether or not it lowers blood sugar, not whether or not it kills you. Can't kill you immediately, but in the long term, it can kill you. As long as it lowers the blood sugar level, it is approved by the FDA, and it can be used. Now, before 2008, and before the studies came out that I just showed you, that was all that was required, is that the medications lower the blood sugar. But after these reports, the industry, pharmaceutical industry, as well as the FDA, decided that we ought to include other criterion for the treatment of diabetes. We ought to show that it reduces the risk of dying of heart disease. So the modern diabetic medications, they do just that. They show you that they can reduce risk factors for diabetes and heart disease. And they've developed a whole bunch of medications. And these are what are being advertised to you on your cable news network these days. But they hardly reduce your risk of complications from diabetes, cardiovascular complications. They reduce the risk only 1.3 to 2.2%. And that's looking at the risk factors. That's not looking at whether or not you die of the disease, but whether or not you lowered your cholesterol. But they're associated with all kinds of serious adverse effects, like genital infections, leg and foot amputations, eye damage, gastrointestinal problems, hypoglycemia, thyroid cancer. Certainly not the way I treat my patients. So let's talk about what causes diabetes. Fat causes diabetes, not sugar. But somehow people believe, and I know why, they believe that sugar causes diabetes because after all, they have high sugar in their blood and they make the most direct connection between the sugar on their spoon and the sugar in their blood, but it doesn't work that way. This all began, straightening out this misinformation began in 1927 with Shirley Sweeney, who asked his medical students to volunteer for some experiments in 1927. And medical students were anxious, of course, to volunteer for studies. And what they did is they fed these students 2 days of a high carbohydrate diet. Now look at what this diet contained. It contained sugar, candy, pastry, white bread, baked potatoes, syrup, bananas, rice, and oatmeal. And every one of the students tested normal, non-diabetic, normal blood sugars. And then they've tested them with a high-fat meal. And that meal consisted of, or 2 days of high-fat meals, olive oil, butter, mayonnaise, egg yolks, and cream. These healthy students all tested diabetic. Fat causes diabetes, not sugar. This should have all been settled by Percival Hinsworth's work, which was published in 1940. In the British Medical Journal, extensive research showed that when you take people who have type 2 diabetes, you fed them high-fat meals, they develop high blood sugar levels, as you see in this chart. Whereas when you fed them a high carbohydrate diet, their blood sugar levels were normal. Yes, they went up after you eat a little bit for a while, but not like they would on a high-fat meal. We should have had no arguments since 1940 in Hinsworth's classic work. Hinsworth is considered the father of diabetes. At the University of Washington, up here in Seattle, they did a study where they took type 2 diabetics, and they initially started them on a diet that was 45% sugar. It was dextrose and maltose, which are simple sugars. We're not talking about potatoes and rice and corn. We're talking about sugar. 45% of the calories as sugar, and then they doubled it to 85% of the calories from sugar. Every aspect of their diabetes improved when they doubled the sugar intake. So they concluded in their paper, these data suggest that high carbohydrate diets increase the sensitivity of peripheral tissues to insulin. In other words, sugar makes insulin work better, and fat paralyzes insulin. Walter Kempner did some classic work. I talk a lot about Walter Kempner because he's one of my most important mentors. Walter Kempner used diet therapy. He was at Duke University for 7 decades. And for 2 of those decades, he supported the medical school at Duke University because of his success with the rice diet, People came from all over the world to be involved with the rice diet to get cures from serious problems like heart disease and heart failure and arthritis and sometimes, often, type 2 diabetes. And his results are 100% of the diabetics, type 2, were cured with a diet that was 93% sugar. Here's the breakdown of the rice diet. The rice diet consists of white rice, fruit juice, and table sugar. Now, if you were underweight, they would often add 500 grams of extra table sugar to the diet. That's 2,000 calories of table sugar. And yet they cured the patients of type 2 diabetes. With type 2 diabetics, an experiment was done recently. In fact, this was done, in 1989. That's not so recent, but it certainly falls within what I would call recent research. And what they did is they fed omega-3 fats, supplements, to type 2 diabetics, and it increased their fasting sugars by 22%. And it increased their sugars after their meals by 35% by adding fish oil pills, omega-3 fats. Fat paralyzes insulin. In a more recent study on type 1 diabetics, they fed them high-fat meals. And what they showed is that the high-fat meals paralyzed insulin activity, and they required more insulin than they did on a low-fat meal. 13 versus 9 units of insulin more. Fat paralyzes insulin. Carbohydrates, including sugar, make insulin work better. Now let's talk about the treatment of diabetics with a healthy diet. And I show a picture of Nathan Pritikin here because, as far as I'm concerned, he's the one that popularized the high carbohydrate diet and the treatment of type 2 diabetes with a high carbohydrate diet, a high sugar diet. Now, when I talk about carbohydrates, I want you to know I'm talking about rice, corn, potatoes, sweet potatoes, beans, peas, and lentils. I'm not talking about table sugar, except for the experiments I just showed you. You know, the type of high carbohydrate diets that I feed my patients, and Nathan Pritikin did his, were based around starches, rice, corn, potatoes. That's what we're talking about. Well, this type of treatment began in 1932, or at least as far as I know, that was the earliest discussion, at least in the medical literature, in 1932 by Rabinovich. He treated a whole bunch of type 2 diabetics with a high carbohydrate diet. And he made some statements that were pretty profound. He said, "May I, however, observe that we now have over 500 patients on this diet, and that 16 failures among them out of 500 patients. And at least in my opinion, they were highly satisfied with the diet." He made a whole bunch of other positive statements, including diets are sufficiently attractive so that when given the option of being sufficiently underweight or taking insulin, the majority of patients selected the former course. I mentioned to you how Walter Kempner got nearly 100% cure of type 2 diabetics. Nathan Pritikin's work, his published studies show that by feeding a high carbohydrate diet on average in their group of patients, they were able to reduce the average blood sugar from 183 to 150 milligrams per deciliter, the oral medications from 284 to 75 pills, and the insulin shots from 280 to 158 by feeding a high carbohydrate diet. James Anderson from the University of Kentucky, he published his research. Insulin usage on average decreased from 26 to 11 units daily. And 11 of the 20 lead patients were able to stop their insulin. Essentially, all of the people on pills were able to stop their insulin, feeding a high carbohydrate diet at the University of Kentucky. David Jenkins from the University of Toronto. Improvements of blood sugars in diabetics with 39% stopping insulin and 71% stopping diabetic pills after 3 weeks of therapy. Neil Bernard from PCRM. He showed, compared to the American Diabetic Association diet, the use of a diet, which happened to be our diet, reduced hemoglobin A1C levels, whereas with the ADA diet, they showed an increase in hemoglobin A1C levels. Other benefits to health, they reduced medications more often than on the ADA diet. They lost twice as much weight, had an improvement in bad cholesterol, and had an improvement in urine kidney proteins. Our published work on 1,703 patients, nearly 90% of the diabetic patients were able to reduce or stop their diabetic medications. That's a 10-year study. Nobody was excluded. All right, so we dealt with the treatment of diabetes. How about the treatment of complications of diabetics? You know, it's one thing to cure the diabetes. How about the complications that are so common, such as eye disease and peripheral neuropathies and kidney failure? How about treating those patients? Well, let me show you some of the benefits of doing the right thing. Let's start with Joslin, who set up the famous Joslin Clinic in Boston. Most diabetics know about the Joslin Clinic. Well, Joslin, a very famous doctor, he said back in 1927, he said, I believe the chief cause of premature atherosclerosis, in other words, heart disease, in diabetes safe for advancing age is an excess of fat. An excess of fat in the body, obesity, an excess of fat in the diet, and an excess of fat in the blood. With an excess of fat, diabetes begins, and from an excess of fat, diabetics die, formerly of coma and recently of atherosclerosis. This is work from Walter Kempner on treating diabetic retinopathy. These results were observed in 20 of the 44 patients who had diabetic retinopathy. You see the back of the eye, which you could look at with a very simple instrument. You just put it up to the eye and any doctor could do it, or anybody could do it. And you look through an ophthalmoscope and you look at the back of the eye. You see on the left-hand side, the retina shows what we call flame hemorrhages. Those are the darkened spots. They look like flames, don't they? And it also shows white exudates. You see those in the eye. After a few months on a high carbohydrate diet, this diabetic retinopathy was cured. You see that on the frame on the right. Van Eck, at the same time, published the same results on how a high carbohydrate diet cures diabetic retinopathy. Here's his work. Same type of thing. So these days, they treat diabetic retinopathy with lasers. Never, almost never, with a healthy diet. Wouldn't you prefer changing what you eat to going blind and suffering from the kinds of treatments that are offered to patients? The expense, the inconvenience. We've known for 100 years that people with kidney disease should eat a high carbohydrate, low protein, low fat diet. A low-protein diet reduces the progression of their kidney disease and death by an average of 33 to 50%. This is classic treatment. Every renal doctor, every renal dietitian should know this. The research is absolutely consistent that if you reduce the protein in the diet of a diabetic and you increase the carbohydrate, their kidney disease gets better, profoundly better. In fact, you can stop or slow the progression of their kidney disease and keep them away from a dialysis machine and other complications and death by feeding them the right kind of diet. How about peripheral neuropathy, where people suffer from horrible pain, burning sensations primarily in their legs and feet? Well, a study done out of Weimar Institute, which is just north of Sacramento, where they use a diet almost exactly like the diet that I use. They're an Adventist institution, and so they do teach a little bit of religion. But they found in a study published on diabetic neuropathy, they found that 17 of the 21 patients were cured in 4 to 16 days. And they were followed up for as long as 4 years, and they stayed cured. A recent study out of Bernard's group showed that with the intervention with a good diet, you also could treat diabetic neuropathy. That was published in 2015. That's from Neil Bernard from the Physicians Committee for Responsible Medicine. So this is the way that I take care of diabetes. I feed them a high carbohydrate diet. I use medications only when indicated. And exclusively, I treat them with insulin as opposed to pills, which cause more harm than good. Now, we run a 12-day internet-based intervention, a telemedicine program, where we take care of hundreds of diabetics. And we're able to get the results that I just showed you, a 90% reduction or discontinuation of the diabetic medications, and tremendous improvement as far as their complications and as far as their overall health goes. In 12 days, we're able to accomplish this. And you get to stay in your own home. You get support from us. The doctor comes to your house. Our support specialists come to your house. And you can find out about this on my website, drmcdougall.com. Any questions you have about treating diabetes or anything? I don't really care. We got a few minutes.
Okay, thank you, Dr. McDougall. Let's see what we have here. Also, before we begin the Q&A, do you have any place where people can find more info about you or your book?
Well, yeah, I would encourage them to go to the website, drmcdougall.com.
Great.
That's where I'll find out pretty much everything that I just talked to you about. I started writing about diabetes and the things that I told you about in 1985. With the first book I published, McDougall's Medicine, A Challenging Second Opinion. It's actually the second book I published. And so this is information that I've used for 46 years in taking care of my patients. This is the way I practice. And I can tell you, my patients are happy. And I'm happy too. You know, I'm the luckiest doctor in the world because my patients get healthy. I don't have to burden them with a bunch of pills and a bunch of excuses. So, you know, not only are the patients happier, but professionals could be happier too. Unfortunately, the medical business is based around pushing drugs. When you push drugs, you can keep to the 7-minute visit. That's the average visit you have with your doctor, 7 minutes. And the way the visit is ended is the doctor hands you a prescription. Visit is over. See you next month. And take care of people with a dietary lifestyle approach, well, that takes time, takes education. Like, for example, in our 12-day program, we run it for 12 days because that's how long it takes. The program I ran at St. Helena Hospital for 16 years. St. Helena Hospital is one of the most respected hospitals in California. It's in the Napa Valley. It took 12 days for us to teach people this program. The resort-based program that we ran in Santa Rosa, California for 18 years took 12 days. But, you know, with an education, people got what they were looking for. They got rid of their diseases. They got off their medications. Sick people take drugs. Healthy people don't. So there's a certain segment of the population that would rather have their diseases cured than to have them covered up with various kinds of medications. And I believe that. And a few other doctors too. There are more and more doctors every day that are deciding that they're frustrated with chasing the patient around with medications and tests and hospitalizations and surgeries, and never to cause them to regain their health. Many of my colleagues are really upset with that kind of practice. They're unhappy. And the fact they're quitting in droves, they're so unhappy. Well, I think the reason they're unhappy is because of the fact that they're not helping their patients. And they can see it. They can see that they're just handing them out a bag full of pills and a bunch of excuses. And the greatest reward in life is helping other people. And you just don't get that in a standard medical practice. Those few physicians who have decided to practice like I do, it's a whole different story. They love going to work every day. They love taking care of patients because they've helped them and they hear such. Now, I commonly hear from people when I'm out lecturing or even in presentations like this, Dr. McDougall, I bet you're tired of hearing this. They want to tell me their story. I bet you're tired of hearing this. And my response is, no, I'm not. I'd love to hear how you've done. It makes me feel so good to know I've helped you. Well, I couldn't say that back when I used to push drugs, which was a long time ago. Probably 40 years ago when I pushed drugs. But I can say that every day is I'm the luckiest doctor in the world because my patients get well. And they get well by fixing the problem. The problem is the food. And then after you fix the food, what you do is you judiciously use medications with the criteria that they do more good than harm. And I will tell you clearly, the diabetic medications do more harm than good when it comes to type 2 diabetics or type 1.5 diabetics. Now, a little insulin is required with type 1.5 diabetics, and insulin is always required in type 1 diabetics. You can imagine how dissatisfied the patients are and my colleagues are by pushing drugs that make the patients sicker. Yeah. Right. Anyway, the diet I recommend is a diet based on starch. I know that's a dirty word, but that's the name of the book, The Starch Solution. My editors, they came to me when I wrote that book back in 2011. They said, you're cutting your nose off to spite your face by calling it The Starch Solution. I said, I'll take that risk because that's the proper terminology for the foods I recommend. And that terminology was changed back in 1977 by industry when the dietary goals of the United States were published. Their lobbying interests, what they did is they got upset because the dietary goals originally told people they had to go to a diet towards what I recommend. Less meat, fewer eggs, fewer dairy products. And of course, industry was very upset about this and they changed as much as they could. In fact, they changed the entire dietary goals. Well, they also changed the terminology. So they call starch, which was what Grandma used to talk about when she had a meal for you on Sunday. They changed it to complex carbohydrates. Can you recognize a complex carbohydrate on your plate or in your garden? No, but you could identify a starch. So by taking away the nomenclature, they've paralyzed you. So I felt it was so important to give you back this term, starch, that I called the book The Starch Solution. The other thing I'm trying to introduce now is the idea that there's a practice of medicine called diet therapy. Walter Kempner practiced this way. Nathan Pritikin had his doctors practice this way. Neil Bernard practiced this way. David Jenkins practiced this way. More and more doctors around the world are practicing diet therapy rather than drug therapy. Yeah. Diet therapy cures diseases because it deals with the problem. The problem is that people in our society eat a diet for aristocrats, for kings and queens of old. What's happened, though, is the number of aristocrats has changed in the last 50 years and maybe back as far as the last 100 years, but particularly the last 50 years, when we've had an increase in transportation and information around the world, so that the rest of the world found out about the high standard of living of Americans. And they wanted to live just like we do. And so the people in Asia and South America and Central America, they adopted the rich Western diet, a diet for kings and queens. And they changed their societies from societies that were virtually immune from diseases common to Americans and Europeans. They had no multiple sclerosis. They had no type 1 or type 2 diabetes. They had no heart disease or obesity or hemorrhoids. But when they switched to the rich Western diet, they developed all these problems as epidemics because rich foods make people sick. And the diet for the human being is a starch-based diet. You are a starchivore, a starchitarian. You are a starch eater. Until you figure that out, you're out of control. Nothing seems to work. But once you identify the fact that the diet of a human being that causes you to look, feel, and function your best is a diet of starch with a few fruits and vegetables. And by the way, it's primarily a cooked food diet. That's what people have eaten for a million years, is a cooked food diet. So, what applies to people who were once healthy, which you can still get some information about, still applies today. In fact, today, not only can you prevent disease, but if you apply these very simple principles, that is, you put people back on the diet that's intended for people, is they heal. And they don't just heal from one problem. The constipation goes away, the chest pain goes away, the inflammatory arthritis stops hurting, blood pressure comes down, the blood sugars come down, you get off the medications by one simple maneuver, and that is providing the right fuel for the human being. And by the way, there has to be a right diet for people, don't you think? There has to be a diet that allows people to look, feel, and function their best. Just like if you're a pet owner, you know the best diet for your horse, for your cat, for your dog, for your parrot. And you feed them that diet, don't you? I mean, there has to be a best diet for people. And what I'm trying to teach you is what I believe to be the best diet for people. If you're not buying into what I have to say, that's okay. But you still have the obligation of finding out what the best diet is for people. So listen to the other speakers in this presentation. Listen to other diet doctors, gurus, et cetera, out there. Listen to them. Give them a fair chance. If what they recommend is not going to kill you immediately, then give it a try. If it's not going to break you in terms of finances or side effects, give it a try. How long of a try? Well, you start to get better when you change to the kind of diet I recommend in about 4 to 7 days, once you clear the bowel of the unhealthy food. And by 4 months, I tell my patients, if you're not better by 4 months, it's likely you're not going to get better. I mean, there are certain things that are permanent in my patients that they can't expect to get better. They can't reasonably expect to get better. Like an arthritic patient who has crooked joints, they're not going to straighten out, but you can stop the attacks on the joints. Those of you who've had heart attacks and killed heart muscle, you can't expect that dead heart muscle to grow back. But you can certainly expect not to have another heart attack. In 4 months, if you haven't accomplished everything that I promise, you better go look for somebody else. Or maybe it can't be fixed. So you should apply that same type of criterion to other people. Give them 4 months. It's enough time. If it doesn't work, get rid of them. Stop buying those supplements. Stop following these dangerous low-carb diets. You could probably survive it for 4 months. The body's tough. Any questions yet come in?
Yep. We have questions now. Thank you for those wise words, Dr. McDougall. And apologies if we offended any aristocrats from that. Hope we don't have any aristocrats in this room right here.
Well, my guess would be that a lot of people who are in transition.
Yeah.
They're trying to figure out, a lot of the attendees of the conference are trying to figure out what they can do to get their health back. And I just caution you against one thing. People love to hear good news about their bad habits. So whenever it comes out how wonderful chocolate is for you, everybody wants to read that article. The articles that are out that say eggs prevent heart disease. Everybody wants to read that article. People love to hear good news about their bad habits. Be cautious. This is human nature. So try and look at what you're doing today and decide you want to be different. You want to have different health, different appearance, where you're not going to be different unless you do something different. And so what you need to do is you need to buy into a program that sounds reasonable, which is different than what you're doing now, which is also delicious and sustainable. You know, often it comes up, well, okay, well, this vegan diet works, but nobody can follow it. Nonsense. I bet if we took a poll on our listeners, we'd find people that have been on for decades. You know, I've eaten a vegan diet for 47 years. Still alive, but I was almost dead when I was a young man. You know, some of you know my history. I suffered from terrible constipation as a child. I lost my tonsils at age 7. I was at the back of the pack when it came to running out in gym class because I had no endurance. I got the acne and the greasy skin and the pimples when I was a teenager. When I was 18 years old, I suffered from a massive stroke, which I still have effects from today. You know, 56 years later, I still walk with a limp and have a terrible time jibing a port jibe on my windsurfer. You know, it affected me greatly, but in many positive ways, that stroke at 18. At 22 years old, my mother called me fat because I weighed 90 pounds more than I do now. I had my appendix out when I was 24. If I had been a sugar plantation doctor and learned the truth about good nutrition from my patients, I'd have been dead by the time I was in my late 20s or early 30s, or at least had my first open heart surgery. But I had good fortune. I had my eyes opened. And I wish the same for you. This is easy. You get to eat as much as you want of delicious food. You know, rather than, you know, there are 2 methods of losing weight. There are 3 methods. One is you can starve yourself and be hungry and in pain. That's called dieting, food restriction. You'd eat the paint off the refrigerator, you're so hungry. I promise you, you never get used to being hungry. You can practice for years. You'll never like being hungry. So that's a failure in itself, is dieting. The other way that you can lose weight is you can make yourself sick. And these are the keto diets, the low carb diets. They make you sick. And when you get sick, you can't eat, you develop nausea. It's a normal part of sickness. So you can make yourself sick. These are the keto diets. And people who follow the keto diets end up with other manifestations of sickness, like more heart disease, all kinds of problems, halitosis, constipation. It's been published by those who recommend keto diets. They published this very result. The third way you can lose weight permanently is you can eat the diet for human beings. There is a diet that allows you to look, feel, and function your best. It's a diet that 99% of people, 99.99% of people who ever walked this earth have consumed. For more than 100,000 years, people have eaten a high carbohydrate diet, with few exceptions. 99.99% of people have followed a starch-based diet. Why all of a sudden in the last 50 to 100 years have we got wisdom? Well, it's because industry has helped us. Anyway, a lot of misinformation out there, folks. I hope you can sort it out.
All right, thank you for that, Dr. McDougall. So let's get on with the Q&A. Just want to first explain to everyone how we do this here. We normally don't take questions directly from the chat. So instead, we ask everyone to raise their hand virtually. To do this, you need to go to the bottom of your Zoom window. If you see the reactions tab, you click that. Then you would also click the raised hand function within that menu. When you do that, we'll see your virtual hand raised, and then we will call on you in the order in which we receive it. So when it's your turn, we'll unmute you and prompt you to ask your question. And with that, let's go ahead and get started. Are you ready, Doctor?
You bet.
All right, let's go. First question, Jackie, what's your question?
Hi, Dr. McDougall. This is Jackie. I was in your March 2012 10-day program.
Okay.
So it is so wonderful to speak to you again. So I have been following the Starch Solutions since March of 2012. I have a McDougall group on Facebook. We have 9,000 members, and I've been doing that for a long time. I'm also Starch Solutions certified. and I'll be going to your meeting on Monday
Okay.
for the Starch Solution graduates. So at this point, I'm 5'7". I'm 58. I'm 5'7". I'm 135 pounds. During the pandemic, I chose to lose weight because I was eating out at vegan restaurants.
Okay.
And I knew, and when the pandemic hit, I couldn't do that, right? So I knew that, I always knew that that was not a great thing. At this point, though, I have to say I'm really pleased to say that, my blood pressure is normal, my cholesterol is 147, my C-reactive protein is 0.4. It went up one number from 0.3, but my hemoglobin A1C went down to 4.9, and I am really pleased with that. Now, so I feel like I'm in great shape. I'm fitter now than I was 10 years ago, but I have one symptom that's kind of perplexing. My thyroid's fine. I just don't really know what's going on with me, and I'm experiencing hair loss. And I had COVID in January, but my hair loss started before the COVID, and it was weird. My hairdresser said to me, "It's like you have COVID hair, but you haven't had COVID." And so I don't really understand kind of it's not alopecia. There's no spots of balding or anything like that. It's just
Hair on
kind
the
of
brush.
all over hair. Yep. Yep. Too much. And too much, actually, it alarms my hairdresser because it's a lot of hair in the sink.
Right. No, I have to say that I hear about this rarely, but common enough. So I've heard your complaint.
Yeah.
Of course, people associate hair loss with a low protein diet.
Okay.
Which is complete nonsense. That's what they resort to.
Mm-hmm.
As you get older, you lose hair. But more importantly, in a woman, whenever she changes her hormonal status, that means she gets pregnant. Well, she starts her menstrual period, she gets pregnant, she starts nursing, or she goes through menopause. Yep. This change in hormone levels results in hair loss.
Okay.
And so that may be what you're noticing is you may be at one of those periods of time when you're, particularly with the weight loss, your estrogen levels are going down.
Okay.
So that's what I would say. You're not going to go bald. This is, I think this is a fairly normal thing to happen. Fortunately, it's rare.
Okay. All right.
I'm glad you've done so well. And I'm particularly glad that you found it fun and rewarding to help other people. Isn't it great? 9,000 people. Yeah.
It's the most exciting thing that I do. I really, really enjoy it. I also now teach yoga. I teach Bikram yoga. And so I don't know if you probably don't remember, you might not have known that when I was at the 10 day, it was a 10-day back then, I would take a cab to the Bikram yoga studio in Santa Rosa. While everybody else was walking, I would take a cab, but that yoga has really transformed my health. But since then, I've gotten into jogging and I do other exercises, and I'm, as I said, I'm healthier now than I was 10 years ago, but, nothing is more important than the food I put in my mouth.
Right.
That's really what has transformed me. And, whether I have to wake up at 4 a.m. to teach a class, to drive someplace to teach a class, or I don't get done with work until 10 o'clock at night, I have the energy to do all of that now. And I'm so grateful for that. But what I love most is helping people.
Yeah. The rewards,
get back to health.
you know the rewards that I thrive off of is knowing you've helped other people. Yeah. We teach a starch certification course, and we give you a certificate which says that you know the starch solution, because you have to take a test.
Yeah.
And so you get this plaque that you can display in your teaching setting that just says you've learned the starch solution. That's all it says.
Yes.
And we offer that on our website, drmcdougall.com. And a lot of people, hundreds of people are certified in the starch solution, maybe thousands. But we have a meeting this Monday, and we're talking about, I believe, the 18th of April. It's this Monday. I may have the calendar wrong, but I think Monday's the 18th.
No, I think, you think Monday's the 18th. Yeah.
Yeah, it's going to be at 9 o'clock in the morning. So everybody who's starch certified graduate is going to meet with Mary and I and Heather. And just an hour we're going to spend together. And then at 10 o'clock, I'll be on Chef AJ's show. And I'm going to talk about, the title of the lecture is Eggs Are for Easter. And it's a whole presentation on what eggs are all about. And this being Easter Sunday today.
Yes.
It's very appropriate, even though I'm one day late. Most people, particularly if you have grandchildren, you have hard-boiled eggs left over in the kitchen. Hopefully I can encourage you to throw them down the garbage disposal rather than eating them. And so that'll be tomorrow at 10 o'clock, and I'll be with you guys at 9 o'clock. It'll be fun.
Excellent. I didn't realize that you would be there, so that's very exciting. I look forward to seeing you again.
All right. Well, thank you. Thank you for your comments.
All right. Thanks, Dr. McDougall.
All right. Thanks, Jackie, for that. Next, we have JJ. JJ, what is your question?
Hi, Dr. McDougall. I'm very excited and a bit nervous. I don't know if you have any other hamburgers being fans of yours, but I'm a hamburger calling you from Hamburg now, and could just spend all night just telling you how much you transformed lives. Now, there's one life you haven't touched yet, and I'm in constant battle with this person. That's kind of where my burning question is going to. My brother-in-law has chronic kidney disease.
Right.
And he's done a lot of things diet-wise, and he thinks he knows it all. Well, I don't think he does. And now the question is, am I on the right track, or am I maybe on the wrong track?
No,
So
right
his seems to be a genetic thing. And I know there's debate about genes being turned on, off and on. But anyway, his dad died of chronic kidney disease. His younger sister has been a dialysis patient, and he's heading for dialysis. And I guess I wouldn't care as much as I do, but he now wants my sister's kidney. So now I'm getting a bit alarmed. And I'm wondering if Walter Kempner's rice diet, which some people think is just completely nuts, if that could help him. That's kind of my first burning question.
Yeah, definitely. The Kempner approach is where I send people with extreme kidney disease. You know, when you get down to only 10% of your kidney function left, and by the way, at 25% of kidney function, you show no signs of disease. The kidneys are so overabundant in their abilities to detoxify you that you have to destroy over 75% of your kidney mass before you run into problems. I would direct you to my website, drmcdougall.com, and under Hot Topics, there's a section on kidney disease. And there's an article I wrote called Diet and Kidney Disease. I would get that in his arms. I have him read that, and that would be, at least he'd have the basic education on what diet would do. If I was going to guess a genetic disease, it would be polycystic kidney disease. That's the most common genetic disease, and that is, the progression of that is slowed with a low protein, healthy diet, and that's been researched and published. And you'll also find a book. In fact, I think the book is still offered free on our website. It's called McDougall's Medicine: A Challenge and Second Opinion. You go in and you try and purchase the book, and when you get to the sign out and checkout, the cost is nothing. We just give it away. So that's McDougall's Medicine: A Challenge and Second Opinion. It's on the website, drmcdougall.com. There's a chapter on kidney disease that I wrote in 1985. So I sure, and the other thing you might do is you might take him to a dialysis ward and just give him a little tour of hell on earth. Now, this has got to be the greatest motivator I can imagine for somebody looking at other ways than a kidney machine. You're tied to this machine, sitting there in a room with a bunch of other people who have similar sicknesses. It's not a pleasant way to spend your week. And you'll be there several times a week. So that may be a motivator for him. And the research is clear. You know, the research is so clear that every kidney doctor, every kidney dietitian learns this research, and then they discount it. They discount it, and I've seen this happen in patient after patient. Somebody with kidney problems will go to the doctor, the nephrologist, they call them. And the doctor will say, okay, well, you know, a low protein diet's important. I'll have you see the renal dietitian. And then both of them say, yeah, diet's important. Come on over here. We'll show you the dialysis machines. The dialysis machine will suck all those toxins off you. Well, it doesn't. It sucks the media toxins off you, the ones that will kill you right away, but it doesn't suck the toxins off you that cause you to have a dramatic increase in dying of heart disease. That's how most kidney patients die, of cardiovascular disease. So it's at best a temporizing treatment, but an important one. But certainly I think, just like all the problems that I talked to you about, I think a patient deserves to hear this first, what they can do by themselves, no cost, no side effects, kind for the planet. What they can do, they ought to hear about it first, instead of the drugs and the devices and the surgeries. I mean, save those for last. So anyway, I just keep working on them. If this is a person important in your life, it sometimes takes a while to get people to change. And if it takes a while, so it be. But if you just keep at them, and there are various techniques that people have for approaching other people who don't understand this. And one approach is like me, I just get it in their face and I tell them. And some of you are not that brazen. Just look good, function well, let the person notice. And then when they ask, tell them what you do. But don't stop trying. Whatever talent you have, you need to share it with people so that they change their diet, not just for their own personal health, but for the health of the planet. Diet therapy for planet Earth is where my mind is these days. In fact, I have a new website. It's called McDougallFoundation.org. And it's dedicated, it's paid for by my 501c3 foundation. So if you've got any extra money, you can always donate to that. And this foundation has put up this website about diet therapy for planet Earth. It's McDougallFoundation.org. And what it talks about is how you as an individual can change what's happening to the planet overnight. Do you know that you can reduce your contribution of carbon to the planet by 80% overnight by changing your diet? I provide you 10 studies. There are no studies that say differently. I provide you 10 studies that show that a change to a vegan diet will reduce your greenhouse gases, your global warming gases, by somewhere between 50 and 87% overnight. So don't stop telling people. We have everything to lose.
Thank you for that, Doctor. And thank you, JJ. Next, we have Sophia. Sophia, what is your question?
Hi. Thank you so much, Doctor, for your dedication. Thank you so much. I have two quick questions. I wonder if I can reverse synovial inflammation due to RA by following your program. And my second question, I try to fast about 16 hours every day, which helped me a lot, but I felt lethargic before breaking fast. Could it be due to hypoglycemia? Thank you.
Well, I think what you ask is, can you help rheumatoid arthritis? You're darn right you can. In fact, I would say our success rate with rheumatoid arthritis, or any kind of inflammatory arthritis, so they call it psoriatic or lupus or nonspecific arthritis, the benefits start in 4 to 7 days once you clear out your bowel. And within 4 months, essentially everyone that's going to get better gets better. And how often do they get better? Well, I'd have to say that in comparison, our success rate with rheumatoid arthritis is similar to our success rate with constipation. In other words, pretty much everybody gets better. And I have a lecture that's up on YouTube. Again, you go to McDougall channel and you get the fewest advertisements on autoimmune disease. And it talks to you about the studies on rheumatoid arthritis and other inflammatory arthritises. So yeah, it's a very rewarding condition to treat is people with inflammatory arthritis, whatever you call it. As far as fasting goes, I can't speak to fasting. I don't know whether you develop a low blood sugar. I wouldn't expect that. See, the body has glycogen stored in it. In other words, it stores sugar in the liver and the muscles. And this 2 pounds of glycogen is released when you're not eating. or when you have increased demands, like if you're going to run a race. So, it keeps your blood sugars at a reasonable level. I don't know why you feel fatigued after 16 hours of fast, but I'm pretty sure that just fasting for 16 hours a day is not going to result in any significant changes. If you fast for 2 or 3 weeks, as you would at a fasting center like True North, which I can't say enough good things about. If you fast for a period of time on water, maybe it's 1 week, maybe it's less, maybe it's longer, you'll experience tremendous benefits because it's the ultimate elimination diet. It eliminates all the cholesterol, all the fat, all the allergens, all the poisons. I mean, after all, you're just drinking water. The drawback to a fasting program is that it has to end. You can only fast for a certain period of time, and then you have to go back to eating. Well, True North teaches our diet. And so what the people leave that center understanding is why they need to eat a high carbohydrate, starch-based diet. So anyway, there's a role for fasting, but as far as long-term results, you need to fix the food. It's the food.
Thank you, Sophia, for that. Next, we have Benny. Benny, what's your question?
Thank you so much, Dr. McDougall. I've had your book since the beginning. Is type 1 diabetes a genetic disease, or do babies develop it from being fed cow's milk? And I see you recommend 10% fruits and veggies, 90% starch. Why not a higher percent of veggies?
Well, you could. There's just that's just kind of a ballpark range. I'll tell you why you can't recommend a diet of 100% starch. Because above ground storage organs, okay, in other words, they store the carbohydrate above ground, which would be seeds in the form of grains and legumes, are deficient in vitamin A and C. So you have to add some fruit or vegetable to get the A and C, but just a little bit, like a slice of orange or a flowerette of broccoli a day. That's it, not much. Whereas below ground storage organs, which would be your roots, your potatoes, your sweet potatoes, your bulbs, your corms, they have 100% of what you need, except for B12, which is a whole other topic. And if you eat them right out of the ground, they got lots of B12 on them too. But below ground storage organs, you could make the diet 100%. Like I've done a presentation on potatoes. I've done a 4-hour presentation on potatoes as the worldwide pillar of nutrition. I also did a 1-hour presentation to clarify the real value of potatoes. Some people consider potatoes to be the cause of diabetes. And that's just fried potatoes or oily potatoes, not real potatoes, not just whole potatoes. And so there's a discussion that I've had with Dr. Michael Greger, which you can find on the website, which clarifies the importance of potatoes, clarifies the fact that it's impossible to design a protein-deficient diet based on whole foods. It also clarifies that all of your foods have adequate beta-carotene in them. I'd encourage you to look up that presentation that I did.
And the cause of type 1 diabetes in babies, is it drinking too much cow's milk?
Yeah, it is. It's from drinking cow's milk. That's what the American Academy of Pediatrics told us in 1984. I showed you the basic research on it. If you go to Medline, you put in cow's milk or dairy products and type 1 diabetes, you'll read for weeks on the research papers. But you see, this kind of information, it doesn't get a lot of publicity. In fact, what happens is the dairy industry will take these kinds of studies and they'll get their spin doctors to spin it in a different direction so that you don't really have to give up cheese.
So it can eliminate.
Yeah, it's the primary cause of type 1 diabetes is cow's milk. But there are other causes of type 1 diabetes. There are viral infections,
right,
injury to the pancreas, but type 1 diabetes is a disease, an autoimmune disease where the body attacks itself. It's a process called molecular mimicry. Look it up. And what happens is you get foreign animal proteins in your bloodstream. The body makes animal protein, antibodies to the animal proteins because we're an animal. It cross-reacts with these foreign proteins from cows and pigs. And it attacks, instead of just attacking the cow and pig protein, it attacks your body proteins. That's how you get autoimmune disease. And again, I have to refer back to this because I know some of you want to learn more about it. As I've done a long, extensive, complete lecture on autoimmune diseases that is present on the McDougall channel on YouTube. You can watch that whole lecture. It's present on regular YouTube too, but the advertisements will make you weary. So we at least have fewer advertisements when we present it on our channel.
Thank you for that, Doctor. And next we have Shanti. Shanti, what is your question?
Hi, Dr. McDougall. I just want to say thank you so much for your presentation. I learned a lot, and it's really an honor just to get to listen to you speak and to get to actually speak with you. I really just wanted to say thank you again for everything you've done. I've been vegan, whole food, plant-based, starch-based, starchitarian since birth. And at 45, I feel actually healthier than ever. And I've just been healthy, in excellent health for my whole life. And it was pretty difficult when I was young because in the 70s and 80s, there was a lot of pressure from family, friends, and community that basically my parents were on the border of child abuse for not feeding their children meat and dairy, but it's actually completely the opposite now. So I've just been reading and learning so much from you and from several of the other plant-based doctors to kind of just been feeling really empowered because in my life, I've inspired and guided a lot of people in this direction. And I'm just so inspired now. I've been following Dr. Rao and I'm so committed to getting us to Vegan World 2026 for your grandchildren, for all the children. And I'm just so grateful for your life's work because above all else, you are so uncompromised at telling the truth and just, being unapologetically straightforward about everything in a way that I could just cry sometimes because not many people will do that. And I'm so moved and I'm just so excited to continue learning and continue the good work. So thank you for everything you've done. And I'm so excited to keep learning and helping others to find this path. So bless you and take care.
Thank you. Thank you very much. A couple of things that I'd like to expand upon. One is that I told you how sick I was as a young man. I almost died when I was eating the rich Western diet with enthusiasm because my parents were worried about calcium and protein because they thought those were the most important nutrients, even though there's no such thing as protein or calcium deficiency. It's never been reported on any natural diet. It's impossible. Yet industry took over and taught my parents about the importance of only two nutrients, which were protein and calcium, to sell dairy and meat. And as a result, like I say, I almost died, and that was before I was 30 years old. My next birthday, which is here in a few days, I'll be 75. And, I haven't noticed yet any deterioration, maybe physically a little bit, but not mentally. So, you can't have a long life. We're all going to die, but you might as well spend your time on Earth feeling as good, functioning as well, as looking as good as you possibly can. And that's just following the natural rules. The other thing is I want to expand a little bit upon Sailesh Rao. He's promised that we would all be vegan on planet Earth. And whether he meant all or not, probably most people would be vegan by 2026. When I first heard him say that, I just thought, nah, this is crazy. But I believe him now, and I'm one of his followers also. I believe him for a couple of reasons. One is that the planet is deteriorating at an exponential rate. When I first started talking about this in 2004, when my first grandchild was born, there's a tremendous amount of denial out there. Tremendous denial about climate change and denial of the science. But that's changed. It's changed because of wildfires and droughts, hurricanes, tornadoes. There's not a place on earth that's not affected by climate change. So people realize this, and they're almost to a point of desperation where they're ready to say, yeah, I'll even change my diet if I can have a home. You understand, ladies and gentlemen, once we raise our temperature above 2 degrees centigrade, nothing will live on planet Earth, and we're at 1.5 degrees centigrade now. I certainly hope the public gets up to speed fast enough, because I have 7 grandchildren. They have no future. The second thing is I took a look at the science, and I presented for you 10 studies on my website, a new website called the McDougallFoundation.org, www.mcdougallfoundation.org. And under News and Insights, I talk about literature that you need to read, science you need to read. And I put those 10 studies up there for you, and they're all open access, so you can read the entire study. And they show that we can reduce our global warming gases, our greenhouse gases, by, well, I would say on average 80% overnight by changing our diet, which is the only thing we have left to save this planet. We've done so many terrible things in terms of fossil fuels that even if we stopped all fossil fuels today, stopped them today, we would still reach above 2 degrees centigrade, and all life on Earth would be extinguished. So we only have one card to play, and that card is to get people to stop animal agriculture, which counts for over 50% of the greenhouse gases, is animal agriculture. We just have to make people aware of this, and I don't know, hopefully there's a segment of the population large enough that wants to continue to have a home. How are you going to do anything on a dead planet? Anything. Whether you're a teacher or a doctor or whatever you do, you can't do anything on a dead planet. Anyway, Salish Rao he's a figurehead, and he's an optimist and a very intelligent man, and I'm right behind him, supporting what he does. And I believe by 2026, we're going to have the planet go vegan. Or I'm wrong. And you know what the consequences of that are going to be.
Thank you, Doctor, for that. Next, we have Lorraine. Lorraine, what's your question?
Hello, Doctor. I am 82 years old. I've been doing plant-based, no oil, 100% for 5 months and lost 40 pounds.
Wow.
I have 20 more pounds to lose. And my question is, I eat 3 tablespoons of chia a day. I want to know if I should stop that and do a supplement of DHA, EPA, algae supplements instead.
You don't need any supplement. Alpha-linoleic acid is from plants, and on plants only. You get tons of it. That's the essential omega-3 fat. Comes from plants. No animal makes that fat. And the human body efficiently converts ALA into DHA and EPA. You cannot run into any deficiency of any of these essential fats if you eat a plant-based diet. Impossible. You can, however, by believing this message, buy into the supplement industry and buy their supplements, which are toxic. Not only are they unnecessary, they're toxic. These supplements encourage cancer growth, for example. These supplements, if they're oil, as they are, cause you to gain weight. The fat you eat is the fat you wear. I don't care whether it comes from a flaxseed or an olive or a cow or a pig. The fat you eat is the fat you wear. The body naturally stores fat for the day when there's no food available. It's the metabolic dollar that you store away when there's no food. Well, if you're eating chia seeds, I think it's chia seeds you said, or flaxseed whole, not going to cause you any harm, because the coat is pretty much not digestible. You don't get much out of it either. If you grind the seed, then of course it becomes more potent with supposedly positive effects, which you don't need. and with negative effects. And then you extract the oil out of the ground flaxseed and you have pure oil. It's really toxic. So stay away from this stuff. Hey, look, if it was necessary that you ate fish or flaxseed or chia seed to get your essential fats, then terrestrial populations would have never existed. And what I mean by that is populations that live away from the ocean or the lakes or the streams, but primarily the ocean. They would have never existed. But the truth of the matter is you get all of these essential fats from plants. Only plants can desaturate at the carbon 3 and carbon 6 position. No animal can do it, no fish can do it. So you get plenty of essential fat by eating rice and corn and potatoes and et cetera. Don't buy into these supplements. You're wasting your money. I used to think you were just wasting your money. You were peeing the supplements into the toilet. But I can't say that these days. You're doing yourself real harm by using these things. Estimates are with traditional vitamin supplements like folic acid and vitamin E and beta carotene. We're talking about huge analyses show that you increase your risk of cancer and heart disease by 20 to 30%. You increase your risk of dying by 20 to 30% by taking these supplements. The Cochrane Collaboration, which is the most unbiased organization in the world, it's over 100 countries involving 40,000 scientists, specialists who weigh in on the scientific literature and try and make it unbiased and understandable. The Cochrane Collaboration says if you take a multivitamin supplement, like the one a day my mom used to give me, that for every 1 million people who take one a day multivitamin supplements, there's an excess of 9,000 deaths. You see, if you take these supplements, what happens is you cause nutritional imbalances. These supplements, they flood your cells with nutrients. And the internal mechanism of the cell becomes unbalanced. And as a result, you don't function well when you flood the system with a concentrated, isolated nutrient. That's why you get sick. That's why you have more heart disease and cancer, because you've caused nutritional imbalances by taking these supplements. Throw them away. You're wasting your money. The only exception I could say to that would be possibly B12, and nobody's asked, so I won't talk about it.
Thank you, Doctor. Next, we have Kim. Kim, what's your question?
Hi, thank you so much for this wonderful presentation. I've been whole foods, plant-based for the past few years. I'm an avid exerciser, normal body weight, body fat, but the last physical I had last year, my A1C was kind of bordering that normal / pre-diabetic level. So I started adopting a whole foods, plant-based, low-fat diet. And my question is, since I am such an avid exerciser, I run a lot, do a lot of weightlifting, Peloton high intensity classes. Do you ever recommend for some of your athletes, patients, that they kind of up a little bit their protein, maybe a little bit more than that 10% from, obviously all from plant-based sources? Or do you just generally stick to 10%?
Well, under certain conditions, like when you exercise or say you're pregnant, you take in more food. And when you take in more food, you take in more protein and vitamins and minerals. It's still 10%, or actually you need 3% of your calories as protein. It just happens you take in more food, so you get more absolute amounts of protein because you eat more. So you always have your needs covered under circumstances that require more calories, more food, such as pregnancy. To grow a baby costs 80,000 extra calories. It only costs 2 pounds of protein. So, and women have been having babies on starch-based diets. In fact, 99.99% of the population that ever inhabited this planet has had babies on starch-based diets without any extra protein supplements or any extra vitamin supplements. We're still here, 7 billion of us, going on 8 billion.
Thank you, Dr. McDougall. Next, we have Michael. Michael, what's your question? Mike, do you hear us? Mike? All right. Mike, get back to us. Try to fix the audio issue on your end. Next, we have Laura. Laura, what is your question?
Hi, Dr. McDougall. Thank you so much for all that you do. I started a plant-based vegan diet for most of my day, but I seem to be having problems with blood sugar issues for the evening, for my dinner.
Well, I think you should stop checking your blood sugar.
I'm not actually checking it, but I've had hypoglycemia as a kid, and my blood sugar kind of goes up and down throughout the day. Like I don't feel satiated enough if I just have vegetables or starches, you know.
You're talking about a couple of different things. Hypoglycemia is a very, very rare condition.
Okay.
And like, for example, people who eat a healthy diet in rural Africa, they run blood sugars as low as 47 milligrams per deciliter, which is normal. So you get hypoglycemia when you have liver problems. Maybe if you take insulin, you'll get certain diabetic pills. But otherwise, I know you feel bad. That's what you're telling me, is you feel bad.
Right.
And we used to blame feel bad on psychological problems. You're neurotic. You're a middle-aged neurotic woman. That's what I started medicine. We told people when they complained. And, and nowadays, they blame hypoglycemia. There have been all kinds of excuses people have for feeling bad. And I know you feel bad. But the reason people feel bad is because they're improperly fueled. And I think once you get the diet really well, really correct, and feel good about it, that you're going to do much better. Now, you just told me that you don't feel good about the diet yet.
Oh, no, I do. I love the diet. I love it during the day.
Cravings. Did you say you still have cravings?
No, I feel that I'm not satiated enough because my blood sugar, I feel a little off. Physically.
Well, that would, to me, would be you have cravings. You are not satiated. You're not satisfied. Anyway.
Okay.
Part of that is psychological. It's an adjustment. And what I call it is the Chinese restaurant syndrome. Many people can relate to this, and that is when we were, carnivores primarily, and we went to a Chinese restaurant. And we had meals that were lots of rice and vegetables and very little meat. We were hungry an hour later.
Right.
Because we were used to this massive muscle and a glob of grease in our stomach, and we were used to that. And that's what we equated with satiety. And when you don't get that, it requires some adjustment. But scientific experiments, and there are quite a few of them, it's absolutely consistent, show that the appetite of the human being is satisfied by carbohydrate. So when you start eating this diet initially, and you've been at it for 5 months, initially, it may still be an adjustment for you. And it usually doesn't take 5 months. I've been running programs of 10 and 12 days for 43 years. And I can tell you that by the end of 10 or 12 days, people are very, very satisfied with the diet. So, the satisfaction will come to you. And as I say, it's carbohydrate that satisfies the appetite. Protein does a little bit, and fat doesn't do it at all. So I think you should just stick at it. You've made great accomplishments so far and reap some of the benefits. So let's go all the way. I mean, get what you deserve.
Thank you for that, Doctor. And thank you, Laura, for that question. Next, we have Marianne. Marianne, what was your question?
Hi, Dr. McDougall. How are you doing?
Oh, pretty darn good.
Thank you so much for your work. I love your messages. I've been listening to your lectures on Chef AJ's channel. And for the last year, I've tried eating more potatoes and I've lost 20 pounds.
Oh, good. Congratulations.
Thank you. Yeah, I've been a vegan for 22 years, but was more of a junk food vegan. My question for you is, do you have any patients? This is actually, I'm asking the question for my mother. She is a vegetarian and is 75 years old. And I was wondering if, do you have any patients who have reversed their macular degeneration?
No, I don't think so, but I've never studied it. But I can tell you this, macular degeneration is the most common cause of blindness in older people. And it's due to primarily to a circulation problem to the macula. You get low blood supply to the acute seen part of the eye, which is called the macula. And the other thing may be a dietary deficiency. And they sell you supplements for your macula containing lutein. Lutein is very high in potatoes. So maybe you're not eating enough potatoes to contribute to the macular degeneration also. But this is permanent blindness. And I would expect it to be reversed. However, work done by investigators reported by Nathan Pritikin, which you can read on my website. I have the scientific studies, and nobody else has them. Nobody else has them, of Walter Kempner and Nathan Pritikin. And I got a hold of them in paperback, and I digitalized them, put them in a PDF file, and I put them on the website for you to read for free. The work of Walter Kempner and Nathan Pritikin. And in the research of Nathan Pritikin, his favorite studies, most important studies, he talks about changing to a high carbohydrate diet for airline pilots. And they got a 10% improvement in visual acuity, which is probably secondary to change in artery supply. And when you eat a high-fat American diet, you drop the oxygen content of your blood by 20% after a single meal. You cause the blood to sludge. You compromise the circulation all over the entire body, including the eyes. But if you eat a high carbohydrate diet, you don't do this. Your oxygen levels are normal. You're not causing the sludging of your circulation. So that's probably accounts for the 10% improvement in eye function, visual acuity. You can also show there are other end organs that are caused by atherosclerosis, end organ diseases. The eye would be an end organ disease, the macula in particular. There's also hearing loss, where the single artery that goes to the inner ear is blocked up and you get hearing loss, you get vertigo and tinnitus. Well, you can reverse sometimes, maybe half the cases, the hearing loss and the vertigo and the ringing in the ears. Heart disease, somewhere between 90 and 100% of the time, you stop the chest pain related to closed arteries. When you have intermittent claudication, where the arteries in the legs are plugged up with atherosclerosis, when you change to this kind of diet, your walking time improves starting at 5 days. And you can walk further and faster days after that, weeks after that. So even though you have damage to the circulation throughout the body, and there are 60,000 miles of blood vessels in the body, and they're all diseased or healthy, depending on what you eat, and you correct the circulatory problems, that you can get some return of function. But unfortunately, a lot of this is very severe disease, and it's hard. It's harder. It takes longer to reverse, but it is reversible. Whether or not the end organ has been damaged to the point where it can't recover is another question. When you damage the eye and you have macular degeneration, that's probably scar tissue. You can't reverse that, or you have a heart attack and cause the muscle of the heart to become a scar. You can't reverse that. But you can, things that are getting insufficient circulation, and the result is as a decrease in function. You can do a lot with these as far as changing the diet. And how long does it take? Somewhere between 4 and 7 days. I mean, good grief! You think of any miracle cure that'll start working in 4 to 7 days. You tell me about it. Well, that's what happens when you change your diet. As soon as you get your gut clear of the bad food, then the good things start happening. And it takes 4 to 7 days to clear the gut.
Thank you for that. Next up will be Michael. Michael, I'm going to unmute you if you could ask your question.
Yeah, yes, I joined late. Did you have anything to say about metformin?
I did. I never prescribed metformin. And you can find the lecture on a couple of ways you can find the information. One is if you go to my website and you go under hot topics and you look at, well, you won't find it there. You go to the question mark on my website, drmcdougall.com, and you put in diabetes. The article I wrote in the year 2017 discusses metformin and what it actually does or doesn't do. It doesn't cause weight gain, and that's why doctors push it. But it doesn't help the cardiovascular system, which is one reason doctors do push it. And they have no reason to do that. Anyway, I find it never necessary to prescribe metformin. And I always take my patients who come to the clinic off metformin if they see me.
Thank you.
Thank you for that.
The other way you can find it is you can look at this lecture. I presented the data. Later on, this lecture will be up on YouTube. And there are also other lectures. You look at my lecture on diabetes, like on the McDougall channel on YouTube, and you'll find the lecture, and you'll find the research discussed there, and you can go look up the research yourself. Because I always present the citation about what I'm talking about, because I want you to. I want you to look up the papers. I want you to, because some of the things I say seem too good to believe. Well, if you think I'm exaggerating, then you deserve to look at me up and to look up the basis of the information that I've come to the conclusions on. That's why I provide for you the studies. Look them up. I think you'll come away finding out I didn't exaggerate at all. It is as it is. Anyway, the website is a great resource for you at drmcdougall.com, and also YouTube. I've given many, many lectures, hundreds that are up there.
Thank you for that. Next one up is Stephanie. I'm going to unmute you, Stephanie, if you could ask your question.
Hi. I have a condition called PCOS that causes insulin resistance in the body. I'm not diabetic or pre-diabetic at this time, but I've noticed something kind of weird. Whenever I eat like starches, especially white potatoes, and even the low glycemic fruits, like the berries and stuff that are okay for people with insulin resistance, and like the green apples and stuff, I get reactions in my body. Like I get like tingly feelings in the hands and the feet, and I just don't feel well after eating those things. But I've seen a lot of the doctors in this conference recommend those foods for people who are insulin resistant or pre-diabetic or whatever. So I was just wondering if you could speak to that, or if you've ever seen anybody that gets reactions from starches and sugars and stuff, and what I could do.
The answer is no. It's because starch is the diet for the human being. There are only 3 things that there are no negative effects to. Only 3 things. Sunshine has negative effects, and exercise has negative effects. But the 3 things that don't have negative effects are clean air, clean water, and clean food. So I believe that I'm serving my patients clean food. But you have to understand that if you're checking your blood sugar after you eat, it goes up. It's supposed to go up. But if you look at the long-term results, what happens is things start working well and the diabetes goes away. How often does it go away with type 2 diabetics? 100% of the time. So as far as other people recommending things, I told you how to test it. If what they're doing for you isn't going to kill you immediately, if you can afford the time and the money and the effort, the inconvenience to give it a test, then give it a test. I'm sure there are a lot of very articulate, believable experts on this presentation. Put them to the test. If it didn't work within 4 months, then they failed you. You can put me to the test anytime.
Thank you for that. Next, we have Phineas. Phineas, what was your question?
Is sprouting necessary or helpful? And what about wheatgrass? Thank you.
Well, I've heard a lot about Ann Wigmore and wheatgrass for my whole career, and I don't think it'll hurt you, but I've always found it hard to believe that it's part of the cure for cancer. As far as sprouting goes, we recommend people sprout beans, peas, and lentils, because there are a couple of sugars in legumes that we can't digest, and it gives you a lot of gas. And the surefire way to get rid of the gas is to sprout beans, peas, and lentils, and then the sugars disappear in the process of sprouting. So you can handle the problem of having extra gas after you eat beans. But otherwise, I don't see that sprouting, I don't see that it improves the quality of your meals. I don't see that's necessary for anything special. No, I don't. So I don't think it does you any harm either to sprout things. And certainly sprouts are an enjoyable part of the starch-based meal plan. So we have sprouts in our house.
All right. Thank you, Dr. McDougall, for that. Unfortunately, we seem to run out of time. Sorry for those individuals who have their hands raised. Sorry about that.
That's all right. They can always pick me up tomorrow.
Correct. Yep.
To Chef AJ's show, and who knows, I might be back next year for this wonderful conference.
Thank you. We'd love to have you next year. Yep.
Yeah, thank you.
All right. So aside from that, we want to thank you, Dr. McDougall, and also I think the audience wants to say something to you as well. So audience, we have to say to Dr. McDougall.
Thank you.